folks, Dr. Eric coming at you from Talon Health Solutions, here to talk about knees. Knees are such an important joint in the body, and one that's actually quite remarkably difficult to treat. But like all of us around here, we've got some really good tricks. I'm going to be sharing you one of my great tricks to help with knee pain today. So let's talk a little bit about this. This is my friend Jerry, okay? Jerry has a knee. Okay, so this is the thigh, the leg, the ankle, foot, and of course the knee. So let's pretend these are bones. So essentially, this is the femur, this would be the tibia, and the fibula. There's two of them. And the knee joins in the middle, and the kneecap, called the patella, is on top. And the kneecap shows up in, after you're born. So you get, in the knee, there's a few different motions. You will get flexion, okay, extension, and actually, one of the key movements that most people neglect, it is rotation, okay? So the knee rotates. Most people think that the hip is responsible for rotation. Actually, the rotation of the knee is very important and causes, and needs to be addressed in any rehab program. So essentially what happens, most people will encounter a lot of problems. They'll encounter problems under the kneecap called patellofemoral syndrome. But what you hear most of is a degenerative knee arthritis. Knee arthritis, when the cartilage wears down, you get fluid built in the knee, and eventually may or may not require a total knee or partial knee replacement. Usually what ends up happening is on the inside of the knee here, it gets thinning. We call that medial compartment degeneration. But we also get thinning of the cartilage underneath the kneecap, which as we're younger, running more active, tends to be more problematic. There's a lot of muscle imbalances throughout the leg. So yeah, I promised you a little clinical pearl, something you can use at home right now to help your own knees. So I'm going to share that. Most of the problems that we see as things go along in inflammation, irritation in the knee is because the tibia is too much rotated to the outside, okay? Because the muscles on the outside of the leg are stronger, it wants to rotate out. So you hear a lot of things do like medial quad kind of exercises. Not a bad idea, but it's not as effective in the short term as people would like. So it's something you got to work on for many, many months. So there's an exercise that we try here in the clinic. We try to rotate the knee to the inside so that the patella is sitting correctly and so that the quads and the hamstrings are well balanced. The ankle needs to be a part of that, but that's a little too much information for this kind of discussion, okay? So let me show you my favorite exercise that I like to do, and I give so many of my knee patients, and it works very quickly, okay? All right, so let's get this set up first. Truck it on back here. So essentially, you want to be seated, okay? Nice and flat. I hope you can still hear me. Seated nice and flat with your foot flat. Let's pretend your knee, it's the right knee that's giving you some discomfort, okay? So you want to keep the knee straight, okay? So then, wearing shoes and keeping your foot flat, look at my foot, but keeping that knee straight, I want you to turn your foot in, just like that, as far as it can go, but keeping the foot flat, and then come out. Don't let the knee come in like so. Turn the foot in, keeping that knee straight, and then come back. Do that 10 or 15 times, repetitions times 3 sets. And you're taking that tibia and you're rotating it in, so suddenly the femur, the tibia, and the patella are sitting correctly. And when they're sitting correctly, those tendons and other things are much easier, okay? They're much easier to be in a lot less tone, a lot less inflammation, a lot less pain. This works even for people who are on surgical wait lists. And if you're on surgical wait lists, in 1 year, 2 years, this kind of rehab program is really important. It can help take some of the pressure off some of the degenerative tissues so that you're able to then do your strength training program on top of it and can work properly. It'll help you walk better, cycle, pick up the grandkids, you name it. This is a really great exercise. I encourage you to give it a try, but it is only advice. If you have something a little more complicated or you want some more information, please give us a call and we'll happily take a look at that need for you. Okay, bye-bye.